With that, I would like to turn it over to Jean Blankenship. Jean?
Thanks so much, Claudia. Good afternoon and welcome, everyone. My name is Jean Blankenship, and I'm with the Office on Child Abuse and Neglect at the Children's Bureau, where I am the program lead for the intersection of substance use disorders and child welfare. We have a little bit of music to go along with our conversation today. In that role, I am the lead for the Regional Partnership Grant Program, which we're going to be talking about today, as well as the ACYF Task Manager for the National Center on Substance Abuse and Child Welfare, which we co-fund with SAMHSA, and I help lead our work here on plans of safe care. I want to thank you all so much for joining the call today to kick off round 5 of the RPG grant. First, I really want to offer my congratulations to all of you for receiving your RPG grant award. It was a competitive group of grant applications that we got, so I just really want to offer you all our congratulations. We are really looking forward to working with all of you as you work to help the children and families in your community affected by substance use disorders. I want to take a brief moment to review our agenda for today's call. We just had our welcome. I know it's a lot of information, a lot of ground to cover. As Claudia said, we'll have time for a little Q&A through a couple of different points during the call today and at the end. A lot of the information may be very familiar with you because we know we have people on the line who represent current and former RPGs as well as some new people. We'll try to move through some of that, but we know there's a lot of new people on the phone too. We're going to talk again about some history and background because it's always important to have context. A little bit about who our key federal staff and TA team are working on this project, little information about what this cohort of RPG grantees looks like. We'll have an opportunity for grantee introductions and hear from our 2 TA providers, talk a little bit about some upcoming events, and talk a little bit about our next steps. So now we'll talk a little bit about history and background. As I said, I think we want to start here about the Children's Bureau. As I said, I sit within the Children's Bureau, and for those of you who are new to working with the Children's Bureau, I want to just provide a brief background on the Bureau. As I said, I know there's many people on the line who are with current or former RPG grants, but I also know that there's new staff being hired and always new people coming onto the project. So I think it's always helpful to give this sort of brief background, and context is so important for the work. So we are the oldest federal agency who was really focused on the needs of children. Since 1912, the Bureau has tackled some of our nation's most pressing social issues, including, as it says here on the slide, infant and maternal mortality, child labor, orphanages, delinquency in juvenile courts, abuse and neglected children, and foster care. CB operates the complete continuum of child welfare services from prevention to the report of suspected cases of child maltreatment through independent living and post-adoption services. And we work to really improve outcomes in these key areas. You can see here that our mission is really focused on safety, permanency, and well-being. And that the Child and Family Service Reviews is our current system to measure states' conformity with national standards on these key outcomes. Our current Associate Commissioner, Jerry Milner, is really focused on prevention and really moving as far upstream as possible. And one thing he always says is if what we're doing isn't strengthening families, then why are we doing it? So I think that's just really important to think about. All right, next slide. You can see here that the Children's Bureau is housed within the Administration for Children, Youth, and Families and the Administration on Children and Families. So there's a lot of layers here, but the Children's Bureau is comprised of 8 divisions and teams who partner with federal, state, tribal, and local agencies through various activities to improve the overall health and well-being of our nation's children and families and promote safe and stable families. I sit, as I said, in the Office on Child Abuse and Neglect, and I've been here for the last 10 to almost 11 years. All right, this slide is going to show a brief description of the Office on Child Abuse and Neglect, and it provides you with an idea of the breadth and scope of the work of OCAN. Many of the divisions and the Children's Bureau have functional purposes, and OCAN is really organized topically. If I want to call your attention to that, a lot of the work that we do is interagency and collaborative in nature, And we work across agencies within HHS as well as across federal departments to address issues related to child maltreatment. You can see we really work on a variety of different issues. Next, I want to turn our attention to what we're talking about here today, which is the Regional Partnership Grant Program, and to really give us some background and understand the purpose and design of RPG and the vision for the work. It really requires us to look at the authorizing legislation. So the President signed Public Law 112-34 into law on September 30th, 2011, and that's what authorized this funding opportunity announcement. And I really want to acknowledge that the RPG program has recently been reauthorized in 2018 as part of the Family First legislation. But this FOA was under the previous authorization, and this funded programs under Title 4B of the Social Security Act and authorizes new demonstration projects. The legislation authorized the Secretary to make competitive grants to regional partnerships to provide, through interagency collaboration, the integration of programs and services and activities that are designed to increase the well-being of, improve permanency outcomes for, and enhance the safety of children who are in out-of-home placement or at risk of being placed in out-of-home placement as a result of a parent or caretaker's substance abuse. The legislation, aside from reauthorizing RPG, also includes funding for research, training and technical assistance, provides funding for the court improvement program, state monthly caseworker visits and formula grants, and amends plan requirements. But simply put, the RPG's grants are to provide funds to assist regions in building their capacity to address issues related to child permanency, safety, and well-being as a result of parental or caretaker substance abuse. And we know that, now that more than ever, this issue is really front and center for many communities. The legislation has several requirements, and one key requirement is that HHS must evaluate and report on the effectiveness of the grants funded by this program. The report must include what were the services and activities provided to families and an analysis of the grantee's success in meeting performance indicators and addressing the needs of families with substance abuse problems. These requirements really drive our national cross-site evaluation and the questions we ask. What did we do? How much did it cost? And was it effective? And it also drives our emphasis on supporting the most rigorous local evaluations possible to build knowledge in the field, and we know the importance of this now more than ever with the opioid crisis affecting our country. People in the federal government field and in the federal government look to the work of the RPGs as models for how to work within communities that are facing the challenge of the intersection of substance use disorders and child maltreatment, and the need to build evidence and knowledge in the field that's really emphasized by the passage of the Family First Prevention Services Act. I also really want to acknowledge something that I said earlier about supporting the most rigorous local evaluations and understanding the effectiveness of the RPG work. Really, that the cross-site evaluation builds upon the rigor of the local evaluations, and that we know the local evaluations are really about telling the stories of your local communities and understanding what the research questions are for your local communities to understand how to best provide services to that population in your community, and really key to the sustainability often of your work as well. So we want to acknowledge both the importance of those local evaluations as well as the importance of the cross-site evaluation. I also want to acknowledge that there is a key component in this requirement in this legislation, which is the match requirement of the grant program, which also underscores an emphasis on sustainability and an emphasis to grantees to take what's successful from your RPG grant and sustain it within your community beyond the life of the grant. And these might be things that require money, like the implementation of an EDP, or someone to continue to support the collaboration that you form. And there also might be things that are non-monetary that you choose to continue on based upon the success of your RPG grant and what you continue to sustain. You will hear us talk about sustainability from the very beginning of your grant, starting today. And we know, particularly for these grants, which are only 3 years, that talking about sustainability is just really crucial to the work that you're doing over this period because of the sort of brief life of the grant. And I just also want to briefly acknowledge here that you can see that we actually have, this talks about the 4 most the 5 different cohorts of RPG programs, but we do have 3 cohorts of RPG that are currently implementing, that will be implementing at the same time. All right, next slide. So I want to talk a little bit about RPG Round 5 and highlight a couple of key things for you. So one is the cooperative agreement. I know we've been getting lots of questions about that, and just really want to acknowledge that we were hoping to get them out last week and we're unable to do so. We're just waiting for a couple of signatures here on them and had a couple of final last-minute edits. So you should be getting those cooperative agreements shortly. I know that there was a date, might have been of October 31st that they were due, but obviously you'll be given more time once those cooperative agreements go out to return them to us with a signature. Then I really want to talk about the next thing is the 90-day planning period and 150-day evaluation planning period. So I know that this time frame is really short. A lot of discretionary grants have a 90-day planning period. I know that feels short for RPG. We have a lot of confidence that you'll be able to begin implementation timely, but really acknowledging that these grants are 3 years and knowing that you need to get implementation up and going really quickly. 90 days puts the goal of implementation services, or at least the pilot of that, around January 2019, and with a 150-day evaluation planning period, it puts us around February, the end of February, and we recognize that IRB approval may not come until the end of that month, or hopefully close to that, but we're hopeful that we'll be able to coincide with the beginning of data collection for the cross-site evaluation that you'll hear a little bit more about later in the webinar. So this next slide gives you a sense of where RPG has been in the past. This is a map of the communities for the first 4 rounds of RPG and what has been served in the past and what's currently being served right now. RPG program is over 10 years old, and over the past 10 years, we've actually funded 101 grants. Round 1 had 53 grants. Round 2 had 17 sites implementing. Round 3, 4, round 4, 17 sites, and now round 5 with 10 sites. Your sites will soon be added to this map, and we're really excited to have your communities be a part of the RPG program and in this larger effort. Then next, I want to talk a little bit about how we approach the work on RPG. And folks familiar with RPG and who've been involved are familiar with this slide. But I really just want to emphasize that we are using a participatory and utilization-focused approach for this entire initiative, including the evaluation, meaning that we really want you to be engaged in the development of this work, and that we want the work to come out with something meaningful that you'll be able to apply and use in your work in your communities well beyond RPG. You will see this type of approach and engagement throughout the life of the project, and that will include engagement with the federal team, your TA providers, the cross-site evaluation. This also is a process that will take a little bit more time and might have a couple of more steps than we ever planned for, but what we feel is really essential because we want to hear from you. We want your input, your experts in what is going to be helpful to those in your community and help us understand, are we asking the right questions? Are we looking at things the right way? What's practical for you in the implementation of your grant to collect data? Questions like that are going to come up, and it's just really essential. You can see where we are today at the top of that circle or clock, talking about the RPG goals and implementation, and that's really where we are in that initial planning period. And we're going to be moving more toward that 2 o'clock place on evaluation and program planning and evaluation planning over the next 3 to 5 months, as I described earlier. Beginning on our calls, which some of you have had some initial calls and some I know are going to happen after the call today, and as well as in our first kickoff meeting, that the first time we'll be able to come together, we'll have several conversations about implementation and the evaluation design, both locally and for the cross-site evaluation. We as a collective group on this effort, both with yourselves in this cohort and the other cohorts that are currently implementing RPG projects, will learn a lot from our work together, and we'll evolve our thinking in many areas in ways that we can apply and do this work even better. All right. So let's talk a little bit about who's going to be working together on this initiative. So going back one slide, this is a list of the key federal staff who are involved in the project. We have the Director of the Office on Child Abuse and Neglect, that's Elaine Bosestedt, and you'll have the opportunity to hear and meet from her at our at our kickoff meeting coming up. The federal project officers, I actually don't have any grants right now in this cohort, but I'm the federal project officer with other cohorts of RPG grantees. The other federal project officers are Dory Snedden, who also sits in the Office on Child Abuse and Neglect, and then we have Cherise Phillips and Tracy Watkins, who both sit in the Division of Innovation, and they'll be the federal project officers for the grants in this cohort. In addition, every grant is assigned a grants management specialist, and we work closely with the ACF Office of Grants Management, and they will become very good contacts for you to understand what grant actions and what you can kind of do fiscally with your grant, and it's always good to be a friend with your grant management specialist. As I said earlier, I am the RPG program lead, and the RPG cross-site evaluation lead is Dory Snedden. Additionally, I want to acknowledge the RPG Technical Assistance Team. The National Center on Substance Abuse and Child Welfare, which is an initiative co-funded with SAMHSA, is funded via a contract, and the Center for Children and Family Futures, as well as ICF International and the Tribal Law and Policy Institute, that group of organizations was funded that contract. Then we also have the RPG Cross Evaluations and TA, an evaluation TA, and that was funded to Mathematical Policy Research and WRMA. And then we've also acknowledged here our collaborators in the federal government, and that's SAMHSA, who I said helps co-fund the National Center on Substance Abuse and Child Welfare, and who we work very closely with on this initiative. And I want to also acknowledge that we work with several other agencies within HHS. I mean, lots of people want to hear about what the work that RPG is doing, but we also work closely with HRSA and Head Start, who are interested, and sometimes are locally, what they fund locally you're connected with on the ground. All right. So next I want to talk a little bit about what RPG Round 5 looks like and what this cohort looks like. We've had an opportunity to review your applications. I want to share a little bit with you about what is in the RPG, the 10 grantees who are in the RPG 5 cohort. So as I said, there's 10 grantees in 8 states, primarily from the Midwest and the Northeast regions, very similar to RPG Round 5 in terms of the types of organizations that are the lead organizations. We really want to acknowledge that there's a real variety of different organizations which are the lead for these partnerships. And that 6 are previous RPG grantees, and some other people who are the lead agencies have been involved with prior RPGs as well. All right, so now we can take a little picture of where RPG 5s are located. These are the locations, states, and service areas for RPG Round 5. And gives you an idea of where you are across the country. And again, we'll be combining this map with the map you saw earlier. That will be a cumulative map of the whole entire RPG program. Next, we can talk a little bit about what your partnerships look like. This is what your partnerships look like in your applications. We know they may have grown or changed during this initial period. We know that some things do change from the time that you've written your grant application to now. I really want to say that we can see that everyone is being responsive to the funding opportunity announcement by collaborating with child welfare, but also you can see really the range of other partners that RPG projects are working with, and the number of different partners that people are working with. And there's a real range of that in each of these projects. In terms of goals and objectives, grantees identified 41 goals and 175 objectives. So we're a very ambitious group with many goals and objectives. And we know that there's a lot of work that we all want to get done in the next 3 years. And we're certainly here to help support that work as well as your TA team. In terms of the common themes for the goals, they're very similar to what we have seen before for RPG. In terms of your target population, again, this is really representative of what was in the funding opportunity announcement, but I do in particular want to acknowledge that 3 grantees specifically noted that they were identified pregnant and parenting women as their population of focus. We do have a handful of grantees as well in RPG4 that are focusing on this population, and just really I think this is acknowledging an increased focus right now on infants born with prenatal exposure, substance exposure, and I think we see that playing out in some of the target populations for the RPG grant. In terms of program strategies, grantees propose more than 50 program strategies, and I think that this is really important. We know many of us involved in this work know that there's not one strategy that people use to work with families and children who are affected by substance use disorders, and we know that you need different strategies to work with different children and different families. And this goes for both at the case and both at the system level. So I think this is representative on why we see so many strategies being used across the grant proposals. Next, we can see the different evidence-based and evidence-informed programs and practices that you all have identified in your grant applications as looking to implement. These are the ones that were most commonly represented, but certainly do not represent the full list of EVPs and evidence-informed programs that people are choosing to implement. This is very similar to what we have seen in the past. And again, as I said, not everything is represented here, but these are what are most common. Okay, so I'm going to go briefly into RPG introductions in a moment. I just want to sort of open it up right now to see if anyone had any initial questions or any questions so far. Okay. Well, there'll be other opportunities. I don't see any questions in the chat box, and there'll be other opportunities for folks to ask questions later on. What I'd like to do right now is, as I announce the project, I'd like to have the project director to introduce the project maybe in 2 to 3 sentences, something that really highlights the goals of your project and anything else that you really want to highlight about your project that isn't highlighted on the slide that you'll see that we have written about the project. So I want to turn it over to folks from our Kids in Miami-Dade. I don't know, Izzy, if you're on the line and you'll be the person to introduce your project to everyone.
Hi, yes, Jean, I'm on the line. Hi, everyone. My name is Islam Pardinas, Izzy for short. I'm with Miami-Dade County. I'm here with Class C McDonald, who is our data analyst for the project. And I believe we have one of our USF evaluators on the line.
Lana Kampolska is on the line, yes.
Great. Thank you, Lana. So we're excited to join RPG Round 5. We have been funded for RPG Round 3 since 2014. And on this round, we're planning to do some peer support within the dependency court setting.
Great. Thanks so much, Izzy, and welcome to the call, and welcome to RPG Round 5. Next, I want to turn it over to the project director from Family Support Services of North Florida, and that might be you, Cindy Hartman.
Actually, it's going to be Gwen Abbott, our project director.
Hi, this is Gwen. I've got the room. Cindy is in the room, and I've got Carlos Cruz here with me as well, and I've got our Vice President of our Case Management, Larry West, is here as well. And we are happy to have this, to have been awarded this grant, and ours is the Preserving Families and Protecting Children, as it states. Basically, we are going to strengthen the cross-system understanding and professional provider competencies and practices as they relate to treatment goals, service planning, practice modules, and outcome expectations through our non-judicial and dependency programs. And that's one of our objectives. Another one is that we strategically select and integrate dedicated service modalities in addressing the specific needs of children and families affected by substance abuse, misuse, enhancing parental capacities, improving family functioning, and improving physical and behavioral health. And increase the evidence base of the Family Assessment Support Team, which is our FAST team, which is a non-judicial program we have here, by applying rigorous and diverse methods to evaluate services, as usual in both FAST and dependency, and enhance intervention services through our IFAST, and to discover which types of service and which settings work best for the families. And we're going to meet that objective by doing peer specialist, parent educator with lived experience, and also the introduction of an LPN nurse, healthcare coordinator.
Great. Thank you so much. We're certainly excited to hear and to see all that work comes together. So thanks so much for joining, and welcome to RPG Round 5. I'm our two Florida grantees. Next, I'd like to turn it over to the project director for the Judiciary Court for the state of Iowa.
Hi, this is Kathy Townsend. I'm the project director for our RPG-5 grant. Also participating today is Beth Moore, who is our project manager, and then Dr. Miriam Landsman from the University of Iowa is our evaluator for our project. We really started with the first RPG grant in developing a partnership between the Department of Human Services, the courts, and the Department of Public Health in trying to take a look at how we can better meet the needs of families who become involved in the child welfare system. We first started with family treatment courts and establishing those, which we've replicated, but then we began to look at a much bigger picture, and so we've really been turning our attention to a multidisciplinary partnership, and we've focused some on pregnant and parenting women, but now we're turning our attention with this grant opportunity to really trying to better meet the capacity in the state to serve children who have been exposed to substances and trauma. And so we're proposing specialized assessment and treatment services and to build an array of services, if you will, across the state to meet the needs of these kids so they can be successful in a variety of capacities.
Thanks, Kathy, and it's great to hear your voice again and to have Iowa back in the fold of our RPG grant project, and we look forward to sort of the new work that you guys are exploring in RPG 5. So welcome, and thanks so much for sharing. Next, I want to turn it over to the project director from Season Center, Jean. I don't know if you're the one who's going to speak or whether you have a new CD yet.
Yeah. No, I'll go ahead and speak. This is Jean Dre, and I'm currently the project director for an RPG 4, and I was for RPG 2, and I have on the line our new project director, Christina Egging-Postma, who I'll be mentoring to be the project director for our RPG 5. We're really excited to continue to move forward. We love the RPG project and what it can do. In the past, our RPG projects have really focused on we're a behavioral health center in providing evidence-based programs to children and families that have suffered a lot of trauma, looking at culture. And with this new RPG 5, we're going to really focus more on in-home services and working with the families in their home and community, really targeting a lot of what's been coming with the Family First legislation. We'll also be working with our clinical care teams that help assess and define what services are best for families. As I said, the intensive case management. The families will have an opportunity, if necessary, to participate in outpatient behavioral health therapy. We are serving 11 counties in Northwest Iowa. Only one of them is urban, so we have 10 rural counties. So with that, we're going to be piloting some specialty clinics and looking at how we can take services to communities and families, and then also providing therapeutic respite care for kids and their families. So we're excited to be part of this.
Great. Thank you so much, Jean, and welcome to RPG 5. I think it's really great that we have such, that we've got such a great representation across the country of the RPGs and really have the history of some people who've been with RPG for a long time. And great to hear about the innovations that you guys are looking to implement in your new project. Next, I want to turn it over to the project director from Centerstone of Illinois.
Yes, this is Stephanie Terry with Centerstone, and I have Taylor Marks, grant coordinator, with me. And then Dr. Catherine Mathis is on the phone call as well. She's our evaluation staff, or she leads evaluation staff. We are also very excited to have this grant. We will be working with families with kids of all ages, and it'll be a randomized study where the families will receive TFCBT, and then the families will either be placed in the Seeking Safety group or the Nurturing Parenting Program group. Services will include in-home and office-based. We have a medication-assisted treatment program that many of our referrals will also potentially be involved with. So we are really excited to get this grant and excited to work with you all.
Great, thanks so much, and great to hear from you, and welcome to RPG Round 5. Next, I'd like to turn it over to the project director from the Institute for Health and Recovery.
Hi, this is Terry Bogage. I'm the project director from IHR, and I believe also on the call is Norma Finkelstein, who's our PI and IHR's executive director, and Terry Tobin, who's from Advocates for Human Potential and our evaluation director. So we've been involved with RPG since the first round, and we were also involved with the second round. This time we're in a new region of Massachusetts, in the central region, so we're excited to work with Worcester. And so we're working with DCF, or Child Welfare Referred Families who have substance use issues, providing home-based treatment and intensive case management services. This time around, we're using a team approach, so we're going to have master's level clinicians doing in-home treatment along with a peer mentor. So they'll work as teams with families providing treatment and case management support services. We're also partnering with the Regional Bureau of Substance Addiction Services and Department of Children and Families to provide for services for families, and also work with the existing Family Recovery Council that's in the central region. And also this time around we're partnering with Everyday Miracles, which is a state-funded recovery center in Worcester, helping to connect DCF-involved families to that center and to that resource. So we're really excited to get started.
Great. Thanks so much, Terry, and welcome back to RPG. Good to hear your voice, and great to hear about all the work that you guys are going to be doing in the next couple of years. Next, I want to turn it over to the project director for Preferred Family Healthcare.
This is Tracy Gold-Campus Preferred Family Healthcare. Drew Moffitt is our project director, and he should be on the line. I'm not sure if he's having problems with his telephone.
Yeah,
I'm happy to give.
Oh, great, Christina. That's great. Looks like he's logged in, but maybe he's having some technical difficulty. So that would be great to hear from you, Christina. Thank you.
Okay. Well, I will hop in. I don't know that I'll be able to live up to his high standards for our introduction, but we are Preferred Family Healthcare. Our project is preserving families through partnership in central Missouri, and we are working with the Missouri Children's Division, the Missouri Department of Mental Health, and other community organizations to provide case management, peer recovery mentoring, access to substance abuse treatment and medical services, parenting support, and a variety of other supplemental services to 180 families in 3 counties in central Missouri. Our project goals are very similar to goals that others have mentioned and include increasing family and child safety and permanency, supporting recovery from substance use disorders, and just enhancing family functioning and well-being. We use a randomized control trial, and the Missouri Institute of Mental Health is our evaluator on this project, and I think Deb Sprague is on the phone with some of her team. And again, Drew Moffitt is our project director, and I am with our funding administration department, and Una Bennett is the vice president of treatment services that oversees this project, and we're very excited to have received this award.
I'd like to piggyback. This is Deb Sprague, and I want to say that Jeff Knoll, who is our main evaluator, is also on the call. Thank you, Christina.
Thank you, and thanks, Christina. I just wanted to give a brief moment just to see if Drew was able to, I don't know if you wanted to hop in or if you had anything to add, Drew, because I know I see you logged in, but all right, he's still maybe having issues. But Christina, thanks so much for stepping in and giving that great introduction to the work that Preferred Family Healthcare is going to be doing with RPG Round 5, and welcome everyone. Next, I want to turn it over to the Project Director for Montefiore Medical Center.
Hi, everyone. This is Anita Jose. I'm here, and also on the line is Dr. Charu Sood. We have an RPG3 grant, and Charu and I are both involved in that, and we are really excited to start our RPG5 project, which is a long name, but essentially we're working with families or mothers to be or brand new mothers at risk of substance abuse, and we sort of recruit them through the obstetrics department at Montefiore Medical Center, and we provide them with some case management services, referrals to substance abuse. We also provide them with a number of evidence-based interventions, including motivational enhancement, incredible years parenting, and contingency management. And just like most of the other people on the call, our goals are really to improve family well-being and functioning, and to improve child welfare outcomes as well as parental substance abuse outcomes. In this project, we're working very closely with a number of departments in our hospital and throughout the Bronx, including the obstetrics department, substance abuse treatment providers. We're also working with the New York City Administration for Children's Services, as well as the state child welfare entity, and we are also collaborating with OASF, the state substance abuse entity, and a number of other partners. Our design, just to briefly, is a randomized control design with folks either receiving services as usual or the enhanced services that I mentioned previously.
Great. Thanks so much, Anita, for that introduction and the introduction on the work that you guys will be doing in RPG Round 5. So great that you'll be able to continue some of your work, and welcome. Next, I want to turn it over to the Project Director for Health Federation of Philadelphia.
Hi, this is Maria Frontera from Health Federation. It's good to be back. We had a RPG2 grant. And joining me today is Leslie Lieberman, Senior Director of Special Initiatives and Consulting, Una Mashmudar, the Clinical Manager for the project, Kathy Antaki, the Lead Child Parent Psychotherapy Specialist, and Meredith Matone, our PI from Policy Lab Children's Hospital of Philadelphia. So we're building from lessons learned, both from evaluation and implementation of our RPG2. And what we're doing is expanding services by co-locating at 4 substance use disorder treatment programs for women and children, 3 in Philadelphia and 1 in Bucks County. And what we're proposing is to test the efficacy of 2 interventions, combined 2 interventions, MIO, which is mothering from inside out. It's an evidence-based model that has been used to help mothers with substance use disorders developing the capacity for reflective functioning, along with child-parent psychotherapy, CPP. And we are proposing, as I said, to co-locate and provide the services. A group will receive the MIO CPP, and the other group will receive CPP alone. And we're working with pregnant and parenting women and their children through the age of 5.
Great. Thanks so much, Maria, and it's great to hear your voice and have you back as part of the RPG family, and welcome to RPG Round 5. Thanks for providing that update on the work that you guys are going to be doing with your new grant award. Next, I want to turn it over to the Project Director for Volunteers of America South in the Dakotas. Good afternoon. My name is Amy Hartman, and I'm with Volunteers of America Dakotas here in South Dakota. And on the phone, I have with me Deb Rice, who is our grants director. We also have Dr. Chad Rohde, who is our research evaluator. And then we also have Vicki Berger, who is with the South Dakota Department of Social Services, the Division of Child Protection, who will be one of our primary partners, along with several other partners within our community. And our program is a residential treatment program for mothers and their children, mothers who are suffering with substance abuse disorder. And along with our primary partner and other partners, we will address the need for formal coordination mechanisms among family-serving agencies to respond to the rising rate of children in out-of-home placements due to parental substance abuse and the severe shortage of treatment services in South Dakota for pregnant, postpartum, and parenting women with substance use disorders. So this project is located in Sioux Falls, South Dakota, and we will be serving families from across the entire state of South Dakota. So we are very excited to be part of Round 5.
Great, thanks so much, and welcome to RPG Round 5, and again, the RPG family. I say the RPG family because I think it feels like to many of us like it's a family. We were really lucky with RPG Round 1. We were able to bring people in twice a year, and unfortunately, we can only bring people in, well, you get brought in twice a year during the first year, and then subsequent years just once. But it certainly feels like family to all of us. I think we all work collaboratively so closely together. So we really welcome you, Amy, and your team, and look forward to hearing more about your work. And as we all look forward to hearing about all your work. It's really great to hear everyone's voices, and thank you all for taking the time to introduce your team and share a little bit about your work. One of the things that we've noted over the years is that grantees really want to hear from each other. You guys have a really good sense of everything that's going on the ground in your communities, and you're there to learn from one another. So this is just a nice way to begin to establish those relationships, recognize voices, and you'll be hearing a lot more from one another over time, including at the kickoff meeting that we'll be having in January. The next, I want to just talk a little bit about the sort of an introduction to our TA providers. As I mentioned earlier, the RPG projects are really fortunate to have the support of the cross-site evaluation and TA on both the programmatic and evaluation side. This is a really good visual of what the support looks like for the RPG grant program and the roles of each sector of TA, including the federal project officer and your grants management specialist. We're going to give each of our TA providers an opportunity to share some key information with you about both the programmatic TA and then also about the cross-site evaluation and the evaluation TA to support your participation in the cross-site evaluation as well as your local evaluations. We have had the privilege of working with both of these teams for quite some time, and I can say that you're all in very capable hands, and there really is a robust training and technical assistance group of people behind these individual organizations and the organizations that they're working with. I want to say that first you'll be hearing from NPR and the project director, Sarah Avalar, and the lead for evaluation TA, Emily Moyduden. And then a little later, you'll be hearing from Jane Pfeiffer with the National Center on Substance Abuse and Child Welfare, and she's the project director for the RPG Programmatic Technical Assistance. So with that, I'm going to turn it over to Sarah.
Great. Thank you, Jean. And I just want to start off by saying how pleased we are to be working with all of you either for the first time or if you were part of RPG 2 or 3 to be working with you again. So as Jean said, my name is Sarah Avalar. I'm the project director for the Cross-Site Evaluation and Evaluation Technical Assistance Project. I'm joined today by Emily Moyduden, who's our Evaluation Technical Assistance lead. And though she's not speaking, I also just wanted to introduce another member of our team, Angela D'Angelo, who you'll be hearing from a lot as we move forward as she oversees the cross-site data collection. And of course, we're just a few members of a much larger team. Next slide, please. So Jean really already covered the RPG authorizing legislation, so I'll just emphasize again, it's a foundation for the cross-site evaluation. There are these requirements reporting to Congress about the services, the activities that are provided to families, and the the grantee's success in meeting those performance indicators and addressing the needs of families with substance abuse problems that come to the attention of the child welfare system. Next slide, please. So I'm just going to give you a very, very brief introduction to the cross-site evaluation. I know that you have a lot going on right now as you're starting up your grants and your services, but we just wanted to give you sort of the high-level view of the focus of the cross-site evaluation. And of course, we'll be providing much more information later on at the kickoff meeting and in other activities. So I'm just going to talk about some of the general areas that the cross-site evaluation will focus on. And if you were part of RPG 2 or 3, some of this will sound very familiar to you. So the first area that we really focus on are partnerships, because that, of course, is the heart of each RPG project. So we want to understand the different agencies that are involved in each project, the roles they play, and the extent of collaboration and coordination between agencies. The second area that we focus on will be participants served, and that could differ, of course, across projects, but we want to look again at each project and the characteristics of people who you intended to serve, your target population, as well as the characteristics of the people who actually participated in the program. The third area are services planned and provided, and for RPG 4 and 5, we're taking a very broad lens to this and trying to understand all of the services that are provided through the grant. So that includes the type of services, the length that someone is in RPG services, and the average dosage or average hours a family might receive in the program. The fourth area is sustainability, and that's to better understand your plans and progress towards continuing services after the grant funding ends. Next slide, please. And then the last two areas are changes in clients' outcomes over time. And Jean mentioned the Children's Bureau is very interested in the domains of well-being, permanency, safety, adult recovery, and family functioning. So the cross-site evaluation, we're looking at changes over time from when a family enters into RPG services in these domains, and then what they look like when they exit from the services. And then the last area that's part of the cross-site evaluation is the impact of the programs. So families might change over time for a variety of reasons, but this last component is really trying to understand what changes were caused by the program services themselves, so the effectiveness of services for families. Next slide, please. So to understand all of these different areas, we have quite a few data sources, and I'll just go over them again very quickly. I think there's time for questions if you have specific questions about this, but broadly the data fall into two different groups. Data that are collected by the cross-site team, Mathematica, and data that are collected by grantees. So in the first bucket of the data that the cross-site team are collecting, that includes information that we'll be extracting from your grant applications and information that you will be providing in your semi-annual progress reports, which are reports that you submit to Children's Bureau twice a year, and we will just review those and extract relevant information for the cross-site. So there isn't any extra work for you. We'll be doing two web-based surveys later on. One is a survey of partners, and one is to get information about sustainability. And then in later years, we'll also be doing site visits and phone interviews with key staff at each grantee. And then data that grantees are collecting, that includes individual level data on the families that you serve, the services that you provide to each family or case, and then client outcomes. And that's, again, to measure change from when someone enters your program and exits your program. And it will include standardized instruments that you administer to each family, as well as administrative data. So again, that's a high-level snapshot, and I'm going to now turn it over to Emily to talk about the evaluation technical assistance.
Hi, everyone. I'm also really pleased to be here with you this afternoon, even if virtually. So now that Sarah's been walking you through the cross-site evaluation part of our work, I'm going to talk through the ongoing technical assistance that we provide. And just as a framework, I want to first describe the goals of our evaluation TA. The evaluation TA is intended to support your efforts to answer important questions in both your local evaluation and also that the Children's Bureau has prioritized for the cross-site evaluation. So in order to do that, we're going to collaborate with grantees and local evaluators to support the rigor of local evaluations, evaluation, enrollment, data collection, and analysis. So in other words, to make sure the design and methods that you've selected maximize your ability to answer your critical research questions and to answer the questions put forth by the Children's Bureau. And we'll also support your efforts to contribute data to the cross-site evaluation. And so the TA is going to have a variety of topics over time, and we will want to be very responsive to the needs that you all put on the table. They could include things like designing your evaluation to address key questions of interest, selecting an appropriate comparison group for examination of program impacts, or obtaining consent. So really the soup to nuts of evaluation, design, and implementation. And I'll say the primary mechanism, or the voices, the faces of the evaluation technical assistant are your cross-site liaisons. So each grantee and evaluator team has a dedicated cross-site liaison, CSL, who works with 3 or 4 grantees in total. And CSLs are going to work in conjunction with your federal project officer and your change liaisons. So in other words, TA will be a team effort that's responsive to opportunities and challenges across the range of the work that you're doing in your grant on the ground. We'll all work together to make sure that the TA really meets your needs. The CSLs have strong backgrounds in evaluation methodology, and this is intended to complement the experience and skills of the local evaluators. So throughout the whole TA process, we aim to learn from you about your priorities, important contextual issues, and what you've designed to help think with you about where we can provide support to enhance your local efforts towards answering your key research questions. Next slide. So there are 4 primary mechanisms through which we deliver evaluation TA. So first, we have regularly scheduled calls. So these monthly calls are already gearing up, and during each month we'll work hard to understand your evaluation design and work with you to determine where support could be beneficial. Second, we'll also respond to additional requests you might have. These might be issues that come up during the calls, something that you reach out to us outside of the call. For example, if there's a particular methodology you're considering where you'd like a little bit more information or background to make a decision for how it fits best for what you're doing. Third, we'll have peer learning network activities. So throughout the RPG cohorts, it's really been advantageous for local teams in total, but local evaluators as well, to connect with each other, to share strategies and troubleshoot. So we'll set up peer learning activities over the life of the grant. And we certainly have ideas, things that have been beneficial in the past, but it's really preferable to design those around your needs and interests. So by all means, please feel free to share ideas with your CSL, or you could reach out to any of us named in the presentation today. And then finally, we'll provide cross-site data quality checks. So once the cross-site evaluation begins and you share data with the cross-site through the systems that you'll learn about in the months ahead, we'll report back to you on any anomalies or quality issues that pop up so they can be addressed early and so they don't create a problem either for your local evaluation or for the cross-site evaluation. Okay, next slide. So because the calls are the primary TA mechanism, I just wanted to spend a little more time on what those might look like. So the regular calls will allow CSLs to stay up to date on, what's going on month to month as you carry out your work, and to provide ongoing support. And this will start during the planning period, which begins right now, with the meetings beginning in the upcoming month. And those early calls really will be about making sure we understand the complex evaluations that you have designed so that we can do a good job providing TA for you. And these will typically be combined with programmatic TA calls, but we can certainly spend more time outside of those calls checking in on evaluation issues. And the content of the calls is going to depend on the type of design, whether or not there are any threats to detecting impacts, to really isolating the effect of the program on child and family outcomes, whether there have been issues identified in prior months that we want to continue discussing from month to month to make sure they can be addressed for additional troubleshooting together. And then, of course, the calls will respond to the interests and concerns of your local teams and the Children's Bureau. And so here I just want to take a moment to introduce to you our CSLs, Charlotte Kabili, Becky Kleinman, and Scott Richmond. They're all on the call today, and I know that they look forward to meeting each of you in the weeks ahead. And now, finally, I just want to touch on some selected cross-site topics for the grantee meeting. As Jean pointed out at the start, we'll have some opportunities to get together not that long from now. When we do that, we'll spend time talking about details on the components of the cross-site study, so digging in a lot deeper than what we're able to do today. We'll talk about your data collection responsibilities and the cross-site data systems for submitting data, and then using data for ongoing program improvement and for monitoring the success of your evaluation and program. But as I said before, we also want to be responsive to issues of concern to you, so we'll also try to address other topics of interest to grantee evaluator teams. So it's another plug. If there's something on your mind, please share it with your CSL, and we may, in fact, come knocking on your email door in the future just to purposely gather some input for that meeting. So I'm going to pause, and I think we'll open it up for a couple of questions before we turn it over to the National Center. And if anyone has questions for me or for Sarah about the cross-site, please feel free to bring them up. All right, then I think with that we can turn it over to Jane Pfeiffer from the National Center.
Great, thanks so much. Well, hello everyone and welcome. We here at the National Center on Substance Abuse and Child Welfare are just really excited about this round of regional partnership grants and are looking forward to working with all of you. I'm getting a little bit of feedback. Can anyone confirm that this sounds okay?
Try again, Jane. I think we're good now.
Okay, great. Thanks. Sorry about that. Yeah, let me just say that we're just really excited about this round of the regional partnership grants, and we're looking forward to working with all of you in round 5. Next slide. So we at the Center for Children and Family Futures, and we operate the National Center on Substance Abuse and Child Welfare that Jean mentioned earlier. Dr. Nancy Young, who's on the call but won't be presenting today, is the project director of the National Center. And under this contract, we provide the programmatic technical assistance for the regional partnership grantees and have since round 1. That's me in the upper right. I'm the program director for the Regional Partnership Grant Technical Assistance Program. Our management staff includes Program Manager Claudia Alvarez-Valver, who you heard from earlier, and Administrative Assistant Lexi Allison. As grantees, you've each been assigned a change liaison, and so you're going to hear the term change liaison and CL. I want to, before I tell you more about their role and who they are, I want to note that in addition to the faces and names that you see here, as part of the National Center and the Technical Assistance Project, we have additional subject matter expertise through our staff and our consultancy pool here at the National Center, as well as the change liaisons have a broad experience including child welfare and substance use disorder, mental health treatment, court administration, infant and child development, systems collaboration, and really much, much more. Your change liaison is part of the federal partners team that you just heard about, and we'll be working absolutely with your federal project officer and with your cross-site evaluation liaison. We'll be working with your team closely in providing technical assistance, and you've heard us call technical assistance TA for short. And many of you know exactly what technical assistance is, but I'm going to spend some time really talking about what to expect in technical assistance through RPG and a little bit more about what it means broadly. But this TA will range from informal conversations over the phone to structured review of documents and helping you really work through planning and implementation challenges, and more on this in just a minute. So if we could go back one slide. Great. So our change liaisons, myself, Linda Carpenter, Kim Bishop-Stevens, and Mariana Corona. Next slide. Kim Coe, Sherston Freskin, and Gail Barber. Next slide. So some of you have already met your change liaison, and some of you will be having calls in the coming weeks and be working more closely with them. But it can be helpful, I think, to put a name to a face, so the pictures certainly are helpful. You'll receive technical assistance, as I mentioned, through a number of different methods, and it's very much based on your needs. We really are meeting all of the grantees where they are. Many of you have your own unique needs and strengths and resources, and so the monthly calls that you see here up on your screen certainly, and that you've heard about a bit already, these are really meant to be more than just a check-in, but really a way to discuss challenges as they arise, and really also to develop strategies to address those challenges. You'll be developing technical assistance plans to help guide your work toward achieving your goals. There's also going to be site visits. Each grantee will receive, all grantees will receive a site visit in year one, and more detail on that to come, but those will start the planning process here probably in the next month or so to start potentially looking at dates, or at least talking about them in more detail. With a 3-year grant period, we really recognize the need to maximize that 90-day planning period, and all of our technical assistants really will focus on this. For those of you who have been RPG grants before and had 5-year grants, often planning and implementation is challenging in 5 years. So we know that the 3-year timeline, whether or not you've had an RPG grant in the past or not, it's both a challenge and an opportunity. We'll be helping you work towards your implementation readiness, and we really want to look at the kinds of things around strategy and intervention, goodness of fit, meaning how is it that the interventions and the different strategies that you've identified, is that, because undoubtedly you've gone to a great deal of thought to select them, but just really making sure that that's the right fit for the population that you're serving, helping you really put into place a process for setting policy for your partnership, identification of additional partners. Often, once you begin your planning, you will quickly see that there are additional partners in your community that you can bring on board. And then other things like planning for fidelity monitoring and getting a communication protocol in place. Lots of things, lots of practical things like this that the technical assistant can really assist you with. So. You also will each undoubtedly have different strengths and challenges that will be assisted through peer-to-peer opportunities. And so you heard earlier on the evaluation side that there are opportunities to have some peer-to-peer learning, and that's certainly true on the programmatic side as well. And so what's a strength for one grantee, something that they've worked through successfully, may be something that another grantee is struggling with. And so we really are going to really work with all of you to identify those opportunities, and through topic-specific calls, other kinds of informal, just putting one grantee in touch with another on a conference call, as well as some more structured kinds of opportunities through monthly topic-specific conference calls. We want you absolutely to build relationships across, and this webinar is the beginning of this process, but we really know that the more that you can rely on each other and we can help make those connections, the more successful everyone is. So your change liaison will be working with you to identify particular technical assistance tools and resources. And what does that mean exactly? Well, a technical assistance tool really is an instrument or a process that helps you examine your current practice or your intended practice, helps you maybe look at sustainability planning, other kinds of tools or instruments that can help you individually look at the work that you're doing or about to do. And then there are additional resources, including publications, webinars, and other things that we can identify and make available to you to, again, assist you and your partners in the work that you're doing. Okay, next slide. So I want to spend just a few minutes here talking about some particular resources that we are going to be working with you and that are available to you, but we also will be using as technical assistance resources and maybe pulling from and referring to throughout our time working together. One example of this resource is this planning guide. And we at the National Center prepared this technical assistance brief to originally last year to assist round 4 grantees. And the brief actually synthesizes information that was gathered from in-depth interviews with 8 grantees, round 2 and round 3 grantees, to develop concrete guidance to inform the planning period and ongoing implementation for future rounds of regional partnership grants. So we incorporated the early lessons and the lessons over the course of these rounds, and really drew from highlights and frankly insights that many of the grantees had, being able to look back at their planning and implementation periods. And we often heard from some of the grantees interviewed, if we knew then what we know now, we may have done some things differently. So I want to just take a couple of moments around the 5 priority topic areas, and they may be, they may or may not, but they may be areas that you've been thinking about or concerned about or perhaps have identified as a particular strength. And so we'll be talking to you, your change liaisons will be talking to you about some of these and helping you to further explore them. We know the first one, child welfare engagement, really has been both a challenge for some grantees and then also a strength for others, but really just the need to ensure adequate program referrals for many of our regional partnership grantees has relied on this strong relationship. And so really identifying that, looking at that, exploring that early on can be helpful. Substance use disorder treatment access. Again, this has been identified as a necessary, of course, component for many grantees. That access is, and a lot that goes along with access has been a challenge, but also particularly integrating parent-child evidence-based interventions with substance use disorder treatment. That some communities are farther along in this process, and others really have some work to do, and so many times grantees are learning more about what's available and how they can strengthen what's available to their families in their program. Provision of children's services, again, another priority topic area, and there's been a lot of progress in a lot of areas in expanding access and provision of services to meet the specific needs of children of parents of substance use disorders. We know that many children have specific needs, and depending on the focus of the program, the regional partnership program may actually be the entity to provide the service, but at the very least, there should be coordination of services to assure that those needs are being met. Data and information systems, really a focus on being able to collect, report, and then use in dissemination to your community, your partners, and your stakeholders, but also to inform program operations. And then lastly, staff turnover. We know that almost regardless of the system, there's often staff turnover, and it's both how to avoid it whenever possible in terms of staff retention, but also how to prepare for it, and how do we really look at leadership and the depth of staff knowledge and make sure that we're transferring that. Again, this publication provides information in much greater detail and provide some strategies and thoughts around these. So if you haven't seen this, it's a good place to start to sort of think about, perhaps consider some things that you might not already have. So in summary, thank you. In summary, technical assistance, or TA, can really be categorized in 4 different ways, or really in 4 different categories. It can falls into 4 different categories, and your change liaison is really going to bring the support to you and work with you to identify what your needs are. There are a few more resources that I'll talk about here in a moment, but we encourage you to talk with your change liaison and your TA team if there's information or resources that that you might be interested in on a particular topic. It's something that we can certainly identify and help you with. The second category around expert consultation and facilitation, and this is where your change liaison can help you and your partners, for instance, work through policy and practice decision-making, helping you to think through options and next steps, sometimes best laid plans, what looked good on paper when you wrote the application. Now that you're beginning early implementation, there can be barriers and obstacles, and your change liaison and your entire TA team can really help you think through that and identify strategies to address issues around low referrals, for instance, or retention issues, and so forth. And so that expert consultation and facilitation is a chance to really have some in-depth conversation, to really to think about some key considerations that the change liaison can really bring to the conversation. Tools and examples, I've talked a bit about that, but we have just a number of not only a wealth of experience that we can share, what's worked for other grantees and in other jurisdictions, but some of the tools such as a drop-off analysis or other kinds of things really can help you look at your practice and look at either what you're proposing and or the kinds of things that you will that you're planning to the work that you're currently doing. And then lastly, online training. Online training, there'll be a variety of options, some of it on a variety of topics. Some of it will be more structured than others, but we know that to the extent that we can do some additional training in a virtual way, it really improves and increases access. We want as many of your partners and team members to be able to improve and increase their knowledge base as well. Next slide. So in just a couple of minutes, I want to talk about just a couple of additional resources, and your change liaisons will be working closely with you to provide this information in some different formats in some different ways. The Regional Partnership Grant really program focuses on collaboration and working across systems. We know, and you'll see on a future slide coming up here, that really one organization, one agency can't do it alone, one system can't do it alone. And so we encourage you to visit our collaborative practice resource page. There are several resources and TA tools. And some of you are familiar with the Collaborative Values Inventory, or CVI. It's just one example of a tool that can help you learn more about your partners and through that process really strengthen your collaboration when you understand more about where your partners, what their beliefs and understanding of particular topics are. Next slide. Not meant for you to really read this slide closely, but it's an additional summary of resources that's available on the National Center on Substance Abuse and Child Welfare website, where we have all additional resources as well as this summary, including on topics like, as you can sort of see, responding to the opioid crisis, screening assessment, referral, and recovery support, just to name a few. Next slide. One of our earlier publications, again, some of you may be familiar with it, Screening and Assessment for Family Engagement, Retention, and Recovery, or SAFER. There are folks out there, I think, who know the word SAFER and maybe don't remember what it stands for. But it's available on our website, and really the takeaway from our work, both in developing this publication and really all the time since then, is that it really takes a collaborative effort across systems to deliver services in a family-centered way, and the continuum from screening and assessment through retention and recovery really needs a coordinated approach involving all partners. That really is the core of much of what regional partnership grants are about. And so again, numerous resources, lots of ways that we can help you explore the work that you're doing, maximize the planning period, and certainly as you move into implementation of your grant. Next slide. Briefly, another resource available on the National Center website. It's not only for you to review, of course, but also we think it could be valuable for you and your change leader to use as a guide in identifying strategies for improving your work, specifically with pregnant women with opioid use disorders and their infants and families. Next slide. Some of you are familiar with this, and I know that many of you are working with infants prenatally substance exposed and their families. And you also may be working locally or at the state level in implementing, specifically in implementing the Comprehensive Addiction and Recovery Act amendments, CARA amendments to CAPTA, the Child Abuse Prevention and Treatment Act, all requiring plans of safe care. If you haven't seen this resource, please let us know. It's available to you and your team. If you want more information about that or aren't sure maybe what's going on in your region or state, we'd be happy to discuss that further with you, of course. Next slide. And then here, too, are some resources specific to families involved in the child welfare system who are affected by the opioid crisis, and some links for you to take a look on your own. Additionally, as you've heard about some of these, as I've mentioned some of these, when you are talking with your change liaison, to really say, hey, I don't remember the name of that particular resource, but that if something, it had something to do with the opioid crisis, we can really connect you with these resources, and more than that, really help you work through how you can use the lessons learned, the information from these resources in a practical way in the work that you're doing with your grant. And then lastly, the next slide, we have 3 tutorials through the National Center. They're online tutorials. They're free of charge. It's really is could be part of a cross-system training, sometimes new staff orientation process. The first one is a guide for child welfare workers. The second one is for substance use treatment professionals, and the third is for legal professionals. And so that it's that cross-system learning to learn about some information about partners and the work that they do. At this point, I'm going to turn it over to Jean, and we're going to field some questions both about technical assistance, really, and anything else from the entire webinar. And then I think we're going to move into some next steps. Jean?
Thanks, Jane. So I just wanted to open it up. I know that that's been a lot of information about the cross-site evaluation and just a little teaser on that, and then really an understanding of what the breadth and scope of the technical assistance is that we'll be receiving and that's available to you. So just wanted to see if anyone had any questions on those topics or anything else that you've heard so far. So yes, so I see there was a question posted asking if the presentation would be emailed to folks, and yes, we will be emailing out a PDF version of the slides to you after the call, along with a link to where you'll be able to share the recording of this webinar as well. So if you had anyone who was not able to attend today, or you wanted to refer back to this for something, there'll be a recording as well. So that will follow probably later this week or early next week. I know that's a lot of information. I'll keep monitoring the chat box to see if there are any other questions that come up. And of course, please feel free, there's no wrong door here. Feel free to reach out to myself. Feel free to reach out to your federal project officer with any questions you might have and follow up to this call. Again, I know it's a lot of information for folks. Let's move on to that. The next question is, when is the kickoff meeting? So I will tell you when the kickoff meeting is very soon. So this is a slide that just talks about the initial next steps. So you're going to be having conference calls with your federal project officer and your TA team. Some of those calls have already happened. Some of those calls are still being scheduled, and some calls are happening soon after the call today, meaning the next couple of weeks. And those will begin to happen on a monthly basis to really help you work through the planning period of your grants, and most likely through the life of your grant. Will continue on a monthly basis. At some point when you're in sort of a strong implementation period, there may be some thinking about the timing of those calls and what meets the needs of your grant. The other thing that will be happening is that we'll be working on grantee profiles and evaluability assessments, or assessments about the rigor of your local evaluations, and that will be those will both be done in conjunction with you. And the grantee profiles will be something that we'll be looking to share with your peers at the kickoff meeting, and also something that will eventually be posted online, because, as I said, many people are interested in knowing what the RPG grants are up to. In addition, I want to highlight these are a list of ongoing discussions and topics that Jane really walked through in prioritizing, as well as Emily and Sarah in regards to the evaluation topics. I really want to acknowledge what both Sarah, Emily, and Jane shared about the work that is ahead. You have a great team and resources for you, but we know there's a lot to get done in a short amount of time, and we'll be there with you to help you with that work. And really want to thank them for highlighting what I think are our priorities and what we know that we need to help you focus on in order to have a strong early implementation of this work. So thank you for that, and also really want to thank them for the presentation on all the TA resources that will be available to you. The other piece that is upcoming will be site visits with your change liaisons. So everybody in this cohort will have a site visit, as it says here, really ranging from February through August. So as you have those calls with your federal project officer and the TA team, our change liaison will start talking with you about what might be the best time to come visit your site, and those will happen over that period of time. So those are some of the initial next steps. Next slide. And this is just a different visual of some of that and some of those dates that people were asking about. So as I said, the TA team calls that have happened, and some will be happening. So the kickoff meeting, I know there was a question about that. That is going to be happening in January. We're looking at dates in mid-January. We're just waiting for the contracts to be signed with the hotel before we can announce those dates. But it is highly likely that it will happen the week of January 14th. It is going to be a 2.5-day kickoff meeting so that you'll have some time to work as a team, because I know sometimes finding that time to work together is hard. So while you're offsite at a meeting getting lots of information, we want to make sure that you have a time as a team, and also with the support of the TA partners to be able to meet with you to reflect on what's being presented at the meeting. Thankfully, I will say that since HHS was funded in the mini appropriations bill, we don't have to worry about a government shutdown preventing our kickoff meeting, and that's what happened, unfortunately, last year for our RPG round 4. So, well, now we just have to worry about weather, but fingers crossed for that. So we'll also be doing some planning for the kickoff meeting in January, and we may be consulting all of you just to see what are the topics and the what you think might be helpful to have during that 2.5-day period. And we know that time talking to your peers and hearing from each other about your projects will be part of that. The other thing I want to state is that So there is a question of will the kickoff meeting be for the project director and the evaluator or others from our team? And I would say that it's really for everybody. The in-person kickoff meeting will deal with programmatic issues as well as the cross-site. And as it says here on this slide, they'll be presenting the full cross-site evaluation design at the grantee meeting because a lot of work has been done and you guys will be part of the cross-site evaluation that's been designed for RPG round 4, and we'll be sort of folding you into that cross-site evaluation. There'll be a lot of information to share on the cross-site in January, and lots of really good discussions to be had. I would also recommend, depending on what you have budgeted for and what you can budget for, that sometimes it's very nice to bring partners to this kickoff meeting as well. For folks who are new for RPG, really having a sense of the breadth and scope and what is, the breadth and scope of the RPG program and understanding it. Many RPGs can share that bringing partners has really made a difference in their understanding of the work. And so if you can, I definitely recommend bringing partners to the meeting if it's possible. Then in February, we're looking at grantees beginning cross-site data collection, and that site visit planning will begin, and some of those site visits will begin as well. And then looking at April 23rd and 24th, that is going to be the annual grantee meeting. So lucky for all of you, you'll get to see us twice and each other twice in a brief period of time. Our annual meeting, as you know, in this first year there is 2 meetings, will be happening in conjunction with the 21st National Conference on Child Abuse and Neglect. And this April meeting will also be in conjunction with the other 3 cohorts, or the other 2 cohorts that are implementing. So RPG Round 3, RPG Round 4, and RPG 5 will all be meeting together at that time. So those are, that's our timeline. And then actually the end of April, your first annual progress report will be due. So there's a lot going on, but we will be here to get you through all of that. Next slide. So this is really just my closing, so I just really want to offer and just open it up to see if there are any more questions. People have been great in using the chat box. But just wanted to see if there were any other additional questions that people might have. And while you're thinking about that, the one other thing I wanted to say is that we are going to get a listserv up and going pretty soon here. I really want to thank folks I know you've gotten a request from some of the federal project officers to complete a list of people who need to be a part of the RPG listserv. So thanks for those who have gotten that back, and if you haven't gotten a request yet, that will be coming soon, and we'll be using that as a start for our RPG listserv, and that will ensure that everyone's getting the correct information that you need to about upcoming events and things that we're sharing. So that will be coming to folks soon. All right. So not hearing or seeing any other questions, I once again just really want to thank all of our partners and the staff from the National Center and Mathematics for helping to bring this kickoff webinar to reality, and for everything that they shared with everybody on the call. I really want to thank the project directors, who I know are just a bit of the representation of your teams behind you that will be implementing these RPG grants. Thanks for sharing a little bit about your grants and providing us with an introduction to your work. And thank you for all of you who've been listening to the call. We're really excited to begin this work with you, and just really thank you for your time and your participation. And we know you've got a lot of planning and you're very busy with everything that you're doing to get your grants up and running. Please feel free to reach out to myself and your federal project officers with any questions that you might have. We're here to support your work. So with that, thanks so much. Let me just check in with Claudia, Jane, to see if there's any other information that we need to share with folks before we get off the line.
No, just that we will be providing, this has been archived, and you'll be receiving it certainly by next week.
Okay, great. Thanks so much. Have a wonderful afternoon, and we'll be talking to everybody soon.
Thanks.
Thank you. Bye. Bye.